Hi guys, this is Dr. Clayton Stitzel at Scoliosis, Pennsylvania clinic. I'm doing a favor here for my patient and friend Abigail, and we're going to do a little chalk talk thing on some of the biochemistry of neurotransmitter rebalancing and how that relates to scoliosis for her really cool blog that everyone should go and check out. Okay? Awesome. So what we have here is this. The patient has a brain, the patient has a spine, and everything seems to be coordinating pretty well up until about the age of adolescence, often 10, 11, 12, when they start going through the growth spurts and things, and we start seeing discoordinated growth and alignment of the spine. So here's the dichotomy we have. What the brain wants to do is the brain wants you to balance the center mass of your head over the center mass of your torso, over the center mass of your pelvis, and it wants to do that three-dimensionally. And again, up until age 9, 10, 11, they seem to be doing that pretty well. But when they start going through these adolescent growth spurts, that starts going wrong. And when it's going wrong, the brain starts sending the message, of the spine, starts sending the message back to the brain saying, we're not balancing the center masses. What should we do about it? How do we autocorrect? And for whatever reason, it appears the brain simply just doesn't listen. It doesn't respond to that message. It doesn't realize there's a problem. It doesn't react, so therefore the patient stays in that kind of a bent position with the center masses not balancing and not autocorrecting. So the part that had us confused is, why is it when we do our Scoliosis Smart exercises here, where we throw the center masses off with the rehab to make the brain recognize that the center masses aren't aligning, and then it reacts automatically. That message, when we artificially supply it with the rehab, goes straight through the brain instantly reacts. So what's the difference between how we're saying the message with the artificial stimulation with the rehab versus what the spine's doing? Well, here's what we think where neurochemistry comes in. You have something called serotonin. Serotonin is the hormone, that wakes you up in the morning and makes you alert, But serotonin during the day converts into something called melatonin. Now melatonin, is the hormone that makes you sleepy. But in adolescent patients, you grow while you're sleeping. So not only does melatonin make you sleepy, but it also coordinates your growth while you're sleeping as an adolescent, all right? So what we're seeing is this. We're finding these kids almost all have very low serotonin levels, And when you have low serotonin levels, that means your conversion to melatonin is also decreased. Now, because you're having a low production of melatonin, your body responds to that by decreasing the number of melatonin receptors, which is what we suspect is going on and why the brain stops listening. Simply aren't receptors there to bind with for the message to be received by the brain. But what if we were able to increase the serotonin levels, which would then de facto increase the production of melatonin? Well, that increase in melatonin production would stimulate a upregulation of melatonin receptors. So now we have enough receptors for the message to come through and bind within the brain and make that normal autocorrection process that isn't occurring during times of growth and scoliosis. Now, it'd be really simple if we could just simply dump a bunch of serotonin into these kids, drive up the melatonin levels, and that de facto increasing the number of receptors. But we have three things here. We have the serotonin, glutamate, and norepinephrine pathways. And if any one of these are elevated, it will cause the serotonin to convert into chymeric acid instead of melatonin. So once again, we don't have melatonin production. So in some cases, the patients have enough serotonin, but one of these three elevated here are causing it to go into chymeric acid rather than melatonin. So dumping more serotonin would just drive up this. So we need to do the urine analysis here, through neuroscience, so that we can determine if the patient's low in serotonin or if it's the serotonin just being converted into chymeric acid by one of these elevated other items here. So the process here of rebalancing these neurotransmitters could have a profound impact not only during growth, but also on the patient's response to exercise rehab, because we're still using those same pathways here to re-educate the brain. So this is how you can have better scoliosis treatment through better neurochemistry and neurotransmitter rebalancing. And the key here is driving up the number of melatonin receptors, through the increased production of melatonin through this pathway. Hope you guys learned something.